I'm Jake. You guys love me a while. So, I've been a veterinarian since 1990. Graduated from Tufts Veterinary School at that point. Have loved Martha's Vineyard since before I graduated from vet school. My wife and I have been coming here for that entire time. We purchased the property here 20 years ago, and we've loved it ever since. Now I'm scared to death to be here after all these talks. But I've been familiar with the tick problem for ages. I've been dealing with it with dogs primarily, cats as well, but mostly dogs. As many of you know about cats, they're very fastidious groomers, so they don't suffer from tick bites as often as dogs. However, they're still potential victims. For dogs, not surprisingly, they suffer from the same diseases that we do. Almost all of them. We don't worry about Powassan, although I guess that's possible. Tularemia, sure. Some of the other viruses, not so much, but we do deal with Lyme, Anaplasma, and Ehrlichia quite frequently. We have the benefit of looking at these things from a slightly different perspective. We don't find the worry in dogs because they don't know about tick-borne illnesses, but we do see symptoms, and we do see the ticks attached to them. And the interesting thing about ticks is that they are able to secrete a numbing substance or an analgesic when they attach, and so they go undetected by the pets and often undetected by people. The advantage to that is that when you find a tick on your pet, you can dig away and get that tick out without it really affecting the pet. So the animals don't get upset with you for removing them, and that's quite important to reduce the transfer of disease. The other thing that I noticed during these talks is that most people, when they find a tick, they think that's it. You know, I've got the tick off, everything's good. But no, it doesn't mean that that's the only tick, and it also doesn't mean that it's the only tick that your pet has been exposed to. If you find a tick and you send it in and it's free of disease, that doesn't mean your animal hasn't been bitten by many other ticks in the past, and if it's been bitten by one, sure as hell been bitten by many others. So it's something to be aggressive about in detection. We have the benefit in the veterinary world of having ELISA tests that we can do on site. And I'm assuming that at some point those will be available readily in human clinics as well. But we can test within 8 minutes and find out if your dog or cat has been exposed to any of those tick-borne illnesses, Lyme, Ehrlichia, or Anaplasma. And it's become part of the routine blood testing for dogs in particular as part of the heartworm testing. So most of you have dogs, and how many of you have dogs? Okay, cats. You know one. So anyway, you're used to having your dog heartworm tested. Well, at the same time, it only takes 3 drops of blood. You can do that test, and 8 minutes later, you know whether your dog has had an exposure to one of those 3 tick-borne illnesses. And then you can decide, with your vet's advice, whether to treat or not treat. I favor treating because long-term effects of any of those tick-borne illnesses can result in very serious medical issues with your dog. Renal failure, brain fog was described earlier, but canine cognitive disorders. There are a whole bunch of things that happen as a sequela to having these organisms traveling around your bloodstream. So I favor being more aggressive. And again, doxycycline is a treatment of choice. I think anyone who has dogs, particularly dogs that spend any time outside, should have a backlog of doxycycline available. Now, I was talking to one of my colleagues here just moments ago, and one of the things we do as veterinarians in terms of treating dogs with doxycycline, many of them don't handle it well, particularly at high doses, and we generally go with high doses. So for a dog that's 50 pounds or more, I'll go with 200 milligrams of doxycycline twice a day for a month. And many of them don't handle that gastrointestinally. So what we do is we freeze the capsules or tablets before we feed them to them. That masks the flavor and masks the scent, as well as allowing that medication to get past the stomach into the duodenum before it completely dissolves. So the chance of gastric upset and regurgitation is minimized. And that's done with many veterinary medications. I'm actually surprised that humans haven't found that as well. I'm sorry. I'm not used to this, it's new to me. So you make the diagnosis, you treat your pets, and I'm always in favor of treating rather than waiting around to see if symptoms will occur. So that's pretty much similar to human medication. Go with the doxycycline. If you find, and this is often the human perspective and not necessarily the dog's perspective, but humans will tell me, my dog can't tolerate doxycycline. So have you given doxycycline to your dog? Well, not really. Okay, well maybe you don't tolerate doxycycline, but in that case, maybe we can start with amoxicillin, we can start with another medication, or we can start with a lower dose and work our way up to it. There are a bunch of ways around this. And so it's important to be able to talk to your vet. And I know on a vineyard that has become a difficult thing because veterinarians are few and far between, and they're very difficult to contact. And so with that in mind, I'll be opening practice within the next 12 months, and it will start maybe as it'll start probably as a telemedicine consulting practice and then move on to house calls, which is what I do in Boston, and have been doing that for over 35 years. It still remains fun, and every day is a different challenge for me, so I still enjoy doing it. And it's an adventure every day, from doing surgeries on people's kitchen floors to treating medically and to diagnosing Lyme and Ehrlichia anaplasma. So, having said all that, one of my focuses with my clients, and I always say to people, if I'm at a dinner party, I'm either the one you want to sit really close to or really far away from, because the conversation is going to get dark pretty quickly. We're going to be talking about bowel movements and vomit and anal sacs and tick-borne illnesses, and it's going to get scary, but it's fun. So, with that in mind, we heard about how many ticks are carried by deer. Well, what about dogs? Dogs are like inviting deer into your house every day if your dog is out in the wild. Dogs are very attractive to ticks, and they have lots of blood, so ticks are very attracted to them and will feed off them regularly. So what you want to do is protect your pet, and if you're not using an oral preventive and or a topical preventive and or a Seresto collar, you're crazy. You're just inviting ticks into your house on a regular basis. So prevention is very critical. So next slide, please. So in 2000, which was 10 years after I graduated from vet school, the options for tick prevention were pretty simple. You had Frontline, which is a topical liquid that everyone tells you just put it all between the shoulder blades and you're all set. I tend to divide it between the shoulder blades and the hips, so it spreads out a little more quickly and gets absorbed more rapidly. Revolution, another spot on, which is an ivermectin derivative, and that's very effective against fleas and ticks and mosquitoes. Preventic, a collar that is worn with Amitraz, another pesticide, and then TCVP collars. These are organophosphates, a little bit more treacherous in terms of reaction. And all of these were pretty effective. In addition, permethrins and pyrethrins were used as topicals on pets, and they often resulted in skin scalding or hair loss. And it was awful when people would come in afterwards and they go on steroids and all sorts of treatments for these problems. But they were happy that they didn't have ticks and fleas to deal with. And then for cats, it was either Frontline or a TCP collar, or organophosphate collar. So the next slide. Once we got to 2015, the numbers expanded, maybe along with the tick populations, but we had more options available and more ingredients to worry about. And so it became a little more confusing. And you can see by the face on the veterinarian that he's got more advice to deliver. And the owners are interested, but they're just listening and they're probably not registering any of what he's talking about. So then, next slide. Now we have all these, and you can see even the pets are upset. We have lots of options. And what I tell people is, look, you've got all these options available to you. Do the research, find out what you think is going to work for you. Your application technique, your pet's receptivity to medication, your relationship with your pet. Decide whether you want to go with an oral tablet like Simparica Trio, which is a one-stop shopping. People feel, okay, we give this pill every month, our pets are going to be free of fleas and ticks and anything else that we have to worry about, no heartburn, no nothing. However, different products have different kill times, and the important thing with ticks is you want to get them dead before they have a chance to disseminate any disease. So the faster the kill, the better. You also have to worry about whether your pet will tolerate that particular medication. So some pets don't. Some pets who have seizure disorders are likely to have seizures after some of these medications, either the collars or the oral tablets. So you have to shop around and be ready to change if your pet has an adverse reaction. So I generally tell people, use an oral tablet once a month for most of them, or once every 3 months for Bravecto. Bravecto is one that people like because they can use it seasonally. But it depends on how your calendar works. If you're not a person who's going to remember every 3 months to deliver it, then maybe every month is better. But I like the oral tablets because they ensure that if a tick tries to feed off your pet, it's going to die before it has a chance to disseminate any disease. In addition, I like to add a Seresto collar, because the Seresto collar or any of the topicals like Frontline act as deterrents to ticks. So they do have chemotaxis, the ability to decipher that an animal is carrying a pesticide, and they'll stay away from the pet. So that's a benefit to you because they're less likely to carry those ticks into your environment and then infect you. So I like that combination. Not every pet tolerates them. So this message is mostly to tell you that no system or combination of medications is perfect for every pet. So you've got to figure out what's going to be what kind. Next slide. So this is the confusion. We've got all of these products available, and then next slide. This is the products and the ingredients, and so you're going to be faced with names that you're not familiar with, and even if some of the ones that were mentioned earlier by Patrick are confusing, this is confusing. So this is the time when you talk to your vet, say what's going to be best for my pet, and then talk to them about what your lifestyle is like, what your pet's comings and goings are like, and how you can best protect your pet as a way of, yes, protecting it, but also protecting yourself. Questions?
Can you live on the island? Can you stop these medications during the winter? Is there ever an off season?
No, absolutely not. That you know as well as I that the temperature doesn't stay below 30 degrees year round here. So with ticks, they don't die and go through a new life cycle every season. They're just around and they're dormant. But once you get up above 40 degrees, you're fair game. They're going to be hungry. And you've got more than one life cycle or stage to deal with. So you've got larvae, you've got nymphs, you've got adults. And they all need to feed at some point. So don't worry about the fluctuations in their life cycle. Worry about your own preservation. Back. Yeah. Go ahead.
Hi. Do they now have an active vaccine for dogs? I know years ago, I think from Jerry, I got a Lyme vaccine. I think that was '94, and they quickly discontinued that. But do they not actively now have a vaccine for dogs?
Yes, the Lyme vaccine for dogs has been available for a long time. I don't remember exactly when it was started, but it hasn't been discontinued like the human vaccine was. Because there's always been a market for it, and there haven't been as many adverse reactions in dogs as there have been in people. So there's been an effective Lyme disease vaccine for, I think, over 30 years, and it remains effective. And there are many of them. All the manufacturers, the major vaccine manufacturers carry a Lyme vaccine. Some of them are based on protein, some of them are synthesized, but they're all very effective, and I use them every day.
I wonder whether you have any observations with regards to what happens when a dog that's been tick bombed comes into our house. That my experience is that it's the same thing. If the dog got into a skunk, the tick bomb becomes part of the house very quickly. Do you have anything that you might suggest to help out on those situations, especially since the first time it rains within the vineyard over the next week or two? That's when the tick bombs are going to occur.
Right, so I haven't had a case of that myself, but I've heard about many of them, and I would suggest immediately using some of those tape methods. So roll a lint roller across your pet, get rid of as many of them as you can. Use permethrin. You can spray them directly, not on the dog, but you get them off. And you can also spray the dog and then get it off right away, because you've got to kill those things and get rid of them. And the other advantage to tick lifestyle, shall we say, is they can't survive off a host in hot weather or direct sunlight for very long. So they dry out. They rely on moisture. So if you get them off and get them dried out, you're okay.
So in my experience, what I've done is I've done a very light spray on the rugs. And I've also, whenever a dog comes in, I have a room that we check the dog in
Brilliant.
before it goes back into the house and gets on the bed or the couch or whatever it might be.
Well, the only other thing you need to do is put in a private shower for the dog. On the outside. But, I mean, showering them is wonderful. The other thing that people, two things, these old wives' tales that people still believe, is one, that if you find a tick on your dog and you don't have the stomach for removing it with tweezers, you should cover it in Vaseline and suffocate it. Do not do that, because the tick will struggle and secrete more material into your pet, and that would be devastating. So don't do that. Get the tick off. The other is that people believe that if their dog has a double coat, like say a husky or a Newfoundland, that the ticks can't get down to their skin. Sure, it's tougher for them, but they're industrious little buggers. They'll get there. So don't assume that your tick is immune because it's got a double coat.
I think we've got one more question, and we've got to move on. Go ahead.
Can you talk a little bit about the use of permethrin in the context of cats, and in particular as to the permethrin-treated clothing?
Sure. The permethrin treated clothing is maybe less dangerous than even considering exposing your cat to a permethrin medication, shall we say. So never put permethrin directly on a cat. They don't handle it well, and they can get very sick. As far as exposure to your clothing, as long as your clothing has been treated appropriately and it's dried, the chance for your cat to have an adverse reaction is minimized, but it's not eliminated entirely. So I would be very cautious about cats and permethrin. It's not a great combination.
Can you repeat that
The
question?
question was, what if your permethrin treated clothing then becomes damp? I think it's more possible for it to be transmitted to the cat that way, so I would be cautious if you're out in the rain and you happen to need to pick up your cat, remove the clothing first. And I have a sense of humor about this with my clients, because I always say I'm a licensed veterinarian and an unlicensed therapist, because people ask me questions. I mean, I probably get more questions than some of the doctors in this room about tick-related illnesses and their problems. And so I encourage people to get naked as often as possible. I mean, if you have a partner, get naked with them and examine each other. I mean, every night, my wife tells me, come look at me. And I know it's a trick, but get to examine each other to make sure that there are no ticks. And the larval stages are really difficult to identify. You really need that magnifying glass that we spoke about earlier.
I had a couple from Quebec who came in, and the gentleman had, he was a Mercedes mechanic. He had Lyme disease, and they said, well, doctor, what can we do to prevent this Lyme disease? And I said, well, you should examine each other carefully, all parts of your body. Are you married? And they said, yes. I said, oh, that's too bad, I'm sorry. The man laughed, the woman didn't laugh. Anyways, so, but enough foolishness. Jake, thank you very much. We have a couple.